So there is a condition called atrial fibrillation. This is an irregular rhythm of the heart. What happens in these group of patients is that the upper chamber of the heart doesn't effectively squeeze or contract. Under normal circumstances, the upper chamber of the heart squeezes first, and a fraction of a second later, the lower chamber of the heart will squeeze. So there's no synchrony. And because the upper chamber doesn't squeeze, the blood stagnates there. Whenever the blood stagnates, a clot will form. There's a pouch in the left upper chamber called the left atrial appendage. It's a downward going sock-like pouch, and therefore the blood stagnates there much more than the rest of the upper chamber of the heart. So in atrial fibrillation, 98% of the time, the clot is in the appendage. Now, the treatment for that is blood thinners. If you don't give blood thinners, the clot will form, the clot may break loose, and once it breaks loose, it exits the heart. And the first organ coming out of the heart is the brain. So one can get a stroke. It can go to the eyeballs, it can go blind, it can go to the arms, it can go to the kidneys and mess up your kidney function, it can go to the bowels and kill your bowels. So wherever the clot goes, it can cause end organ damage. So you have to give the patient blood thinners. Now, blood thinners by definition will make you bleed. And therefore, there are patients who are higher fall risk, older folks or people with arthritis, they fall, and these group of patients may bleed. If they fall in the head, they'll bleed in the brain. So what do you do for these group of patients? These people can get a device called left atrial appendage occluder. So there are two devices on the market currently. One is called a Watchman device. One is called the Amulet device. The device is made by two different companies. They're both very, very effective. It's like a filter. You go in from a blood vessel in the leg, a vein in the leg up to the heart, go to the right side of the heart, cross over to the left side of the heart, and deposit this filter in the left atrial appendage. It closes that up. No clot can come out because of the filter. So you can stop the blood thinner. So even if a clot forms, it's going to form in the appendage, but the clot cannot come out. And there are these fine legs that this filter has. It hooks onto the inner lining of the appendage. So even if you stand on your head, it's not going to come out. It's a permanent treatment for this group of patients. It takes about 25 to 30 minutes to do. Outpatient, they go home the same day. So it really has changed the treatment options for these group of patients who are high risk for bleeding in patients with atrial fibrillation.